Welcome to episode 5 of OSCE with Mudau ES. Today we will be focusing on wound care procedure. Wound care is the procedure that includes cleaning, disinfection, and protection of the wound while respecting the rules of hygiene. It is also done to promote healing. As in all procedures, the first and foremost thing to do is to wash your hands to prevent cross-infection. To show Ubuntu, it is very important to greet your patients always, and do not forget to introduce yourself. This will help you to create trust. Kindly explain to the patients the reason why you are there, which means explaining the whole procedure that you are going to do or you are about to do, and immediately after that ask for consent if you may or not continue with doing the procedure on the patient. Once the permission or consent has been given, assess your immediate environment of the patient and ask the patient's needs. The patient's needs include: are you comfortable? Do you need anything before I can continue with the procedure? Are you sitting well? Assessing the environment, it also forms part of patient's environment and safety as in accordance to the patient's rights charter. Decontaminate your hands and immediately wear gloves so that you can be able to expose the patient's wound. This will give you access to assessing the patient's wound before you collect any items needed. After assessing the patient's wound, discard all the dressing including the gloves that you are wearing so that you may be able to proceed with the next step. The planning phase includes collection of gloves, dressing pack, prescribed solution by the doctor on the prescription, the bandages and tapes that you'll use to close the wound, the red and black plastic where you'll be discarding all the waste material in accordance with the waste segregation policy. Before you proceed, do a full aseptic hand wash to prevent cross-infection. Open the sterile dressing pack that you collected. Open it on top of the dressing tray that you came with. Make sure that you do not contaminate the dressing pack as a whole. Wear your personal protective equipment. This may include goggles, apron, gloves, and gowns. This will be determined by the type of wound that you are doing. Clean the patient's wound only using the prescribed solution from the prescription by the doctor. Dress your wound using the material also prescribed by the doctor, and also try to practice health economics by customizing all the dressing packs that you'll be using on the patient. After making sure that the wound is not tight and it's secured and not leaking, discard all the materials that you've used, including the gloves. Perform the hand wash procedure again as guided by the 5 moments of hand wash that states that you should wash your hands after doing an aseptic procedure. Once your hands are dry, you may continue doing an evaluation on the wound you've been dressing to check if the bandage that you've applied are not too tight, there's no leakage on the wound, and also the patient is still comfortable and not constricted. Following the principles of record keeping, make sure that you use a black pen, you write your date, time, and your signature at the end. Indicate everything that you've done on the patient, and also report everything that you've done if there's any abnormality to report.